Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I have been performing fat transfer for 15 years now, and probably a day doesn't go by in the operating room where I don't do the fat transfer. And I do it over all, different portions of the body. I think that most commonly I will do it in the face and also in the buttock region. And there are some differences between the two. So let me explain. People want to know, Dr. Shapiro, how is the fat placed in the face, and how is it placed in the buttocks? And I think the answer to the question is very carefully, and I think it should be done with technical expertise in a way that we are trying to create radial expansion to give you some more youthful volume in those particular areas. In the face, I will process the fat the same as I do in the buttocks. I will take that fat, I will purify it, and I will re-inject it with very, very small cannulas. I have no incisions in the face when I inject it, so the cannulas that I use are usually less than 1 millimeter in diameter. I mean, that's really small. And that fat goes in not in little clumps, but it goes in almost like dust. And consequently, that fat will get its own blood supply. Hence, fat transfer, again, is not just a filler. It's a transplant with a long-lasting result. That fat is placed in all layers of the face, depending upon where I'm placing it. For instance, around the eyes and the cheekbones, that fat will go right against bone and beneath the muscles, and that gives you the radial expansion, and it also camouflages so you don't see any irregularity. Other areas of the face, that fat is placed with the same small cannulas, whether it be the nasolabial fold, the lips, or along the jawline, a bit deeper, a bit more superficial, not on the bone, but along the jawline it's usually on the bone. But the other areas like the nasolabial folds and the lips, that goes more superficial because we want to see more radial expansion, if you will, with less volume. In terms of other areas such as the temples or in the forehead, again, that's placed with a very small cannula, usually in the subcutaneous tissue and also a bit closer to the skin. I can use fat in a very superficial fashion where it's put in with a very small cannula and fill in some of the wrinkles around the mouth. So depending upon where I'm putting it will tell me where I need to put in terms of the depth of the injection. When we're talking about the buttock, usually that fat is processed. I will add antibiotics to it, and then through a small incision beneath the rear end fold, I will place that fat through a somewhat larger cannula, usually about 2 millimeters, and I will put that in all layers of the buttocks. That fat goes beneath the gluteus maximus muscle, into the muscle, and also above the muscle. The beauty is that I can correct a lot of contour irregularities when I put it superficially. I can release some scarring in terms of cellulite, and I can put that fat in a very artistic fashion. And remember, it is an artistic procedure, whether it be the face or the buttocks. I'm trying to give a much more youthful, a much more voluptuous appearance that doesn't look done. Now, in the buttocks, depending upon what people are looking for, of course it'll look done. So it'll give somebody a more voluptuous, robust rear end, if you will, and that also is enhanced by the fat that I take out above the rear end and the flanks. So again, the fat is put in precisely, it is put in technically with incredible expertise, and consequently I think I see a long-lasting result from my fat transfers. Depending upon where I'm putting it will dictate the size of the small cannula that I use, but overall I think it's an incredible procedure. It is one of the most incredible advancements in plastic surgery, as I said, in the last 10 years, and I do it almost every day in my practice. Best way to figure out if you're a candidate for fat transfer, come in for a consultation. I'll tell you what I can do for you. Thank you very much.